So we have a very special guest headed our way. We're going to ask him to join us in just a moment here. So bear with me as we look for him. We did it. Here we go. Dr. Bloom, we found you.
All right.
And
what
you
is
were
up?
worried. All of my guests always get a little worried, like, is the live stream going to work? And Dr. Bloom, it worked. How are you?
Well, I'm doing all right.
Oh, I'm getting motion sickness already. I can't keep up. This is fun. All right, so how's home? How's life? What's going on?
Things are, it's different. I'm like a person who loves to be in the operating room, seeing people, and now I'm just kind of hanging out, doing some more academic stuff, which is nice. I'm doing a lot of academic writing. We have some new projects that we're figuring out, which is nice. Yeah, but it's a different thing.
Different feel, right?
Yeah, it totally. And also, I have my wife who works, she's working remotely, she's a lawyer. And then my two kids are doing, remote virtual learning. So I've been going into the office, which is like a ghost town, but I go in, a couple times a week, 2 or 3 times a week, just to sit there. I literally sit at my reception desk and do work just so I can get stuff done.
Hello, anyone here? It's kind of creepy, isn't it?
It is so strange.
Very different than your trip. This is Colorado up here, right? So you were?
Yeah. We have a place in Colorado. So that was hiking in Aspen. Yeah.
Now, was that your decision to Colorado or your wife's decision? Which one of you is more of the Colorado fan?
Definitely me. I've been going there for almost 36 years. My parents have, taken me out since I was a child, and we continue to go out.
Well,
So
I'm
it's
excited.
fun.
So we're going to spend the next half hour, 45 minutes together. I have
Awesome.
an entire list of things we're going to cover. For you guys at home, our goals today are really to cover non-surgical versus surgical nose jobs, safety versus risks. I want to talk to Dr. Bloom about what's going on in the future of cosmetic plastic surgery. I'm sure you're seeing trends coming and going. We're going to talk about staying safe at home and in the office. And then I'm actually going to dig in a little deeper and try and get your opinion on when you think we might be able to reopen, in case you've heard anything that I haven't. I also have 15 questions from audience members who've already submitted. You guys are also always able to submit your questions in the comments below, and we will get to them if we can. All right, Dr. Bloom, so before we say goodbye to the Colorado skies, I'm sure you missed going out there. So hopefully in 2020, you are able to do that soon, right?
Yeah, we still have a trip planned for the end of August. So
fingers crossed. Fingers crossed.
Hoping.
I have a trip in July planned, and I'm already getting nervous. Have you ever heard of Provincetown, Massachusetts?
Yeah.
So it's like this mecca, big party that happens all summer long. We went last year, had a good time. This year, we're trying to get our money back already because I just don't think it's going to happen, and I'm getting kind of nervous. Yeah. Okay, so nobody came to hear us talk about our traveling. They came to talk about noses. Nose.
Well, that's a surgical rhinoplasty with some rib cartilage. So that's like the far end of the spectrum.
No, great. Yeah. That's what I'm here for. We're here for both ends of the spectrum. Now, so rib cartilage, you had to actually cut this patient's rib open? Tell me about it.
Yeah, so this is a patient who came to me. This is recent. I did this. This was actually my last case before we were kind of closed, and so I did this about 3 Fridays ago or 2 Fridays ago, and this patient had on the left. You can see she had a rhinoplasty prior, somewhere in the New York area, and her nose is very rotated, meaning it's turned up, which she didn't like, and very scooped out. So it's like kind of like almost like a banana shape where the bridge is really sunken in. And in order to counter rotate or bring the tip down, we took rib cartilage, and you can use either a radiated cadaver rib, or you can take rib from the patient's own self and reconstruct both the tip and the bridge with that rib cartilage, which we did here.
That's crazy. So you can actually, I'm going to dig a little deeper. Cadaver cartilage. Do you have like a connection? Do you have a friend in the morgue? How does that work?
No, so there's companies that actually, there are tissue banks basically across the country that make and package the rib cartilage. and you ask for a certain size piece and they can send it to you, and then you can use it. And there's like reports of some really, really great rhinoplasty surgeons for years that have had reports of over 1,000 cases using irradiated rib cartilage. And the risks are essentially none. The biggest risk is that the rib cartilage over time can warp or bend. But I haven't seen that a lot in my practice. It usually works really well.
So is there any chance the body rejects it since it's not yours, or cartilage doesn't need the same blood type to work?
No, I mean, you do need you need blood supply, which is supplied by like the septum and the flap, the surrounding skin, but you're not going to get a rejection because we call it, it's a homograft, which is basically of the same tissues as your body. It's not an allograft coming from you, but it's similar.
Got it. I pulled this picture because I wanted to talk about, are people asking for more post-op procedures right in the waiting room? Is that why you posted this? Because I saw you might have commented like you keep asking for it. Do people just ask for noses in general, or do people ask for like specific things?
No, so this one I had a couple days prior, I posted on my Instagram of me carving the rib cartilage. So you have to harvest the rib, and then you have to like actually cut it into these strips. So I had posted, and they're like, well, I want to see the actual before and after picture from the table. So that the after that's what she looked like right on the operating room table.
Now, will she swell? Like, will you have to bandage up and swell? Okay.
Yeah, so she lives in New York. So I've been, doing some virtual follow-ups with her. And yeah, she definitely had swelling afterwards. But she's saying every day it's getting better and better.
Well, I love hearing that. So is this patient the same? Did you also do a rib cage or something totally different?
No, this is actually a patient. She's a nurse, which is cool. She's in she's in nursing school right now in our area, and she's I've known her for a long time. She's a great patient, and she has always, the picture on the left that's her, that was her nose, and this is a primary or first time rhinoplasty where I do about, I would say over 90 to 95% of my noses are what we call a scarless or an endonasal rhinoplasty. So all of the stitches are in the nostrils. Exactly. So there's no scars externally, which is really, really nice.
That's so crazy. Okay, so I have a couple questions here pertaining to nose jobs before we change topics. One of the questions I get all the time, and I'll show you a liquid nose job of ours in a second, and I get this all the time. Why would you suggest someone who's had a surgical rhinoplasty not go in for a liquid nose job? I have my canned answer. I want to know if yours is the same.
Yeah, so here's the main issue, and you had really nicely on one of the things put it. Yes,
you're welcome, yes. Dr. Bloom. Teamwork.
That's what I'm talking about. I love that. So that is a picture of the vascular or blood supply to the nose. So I do injections in the nose post rhinoplasty, and I even have some rhinoplasty surgeons who are friends of mine locally who send me things if they need a tweak, and I do them. But this is not for your average injector. And so there are ways to stay safe in injecting a primary nose is if you stay on the bridge in the midline. You can even inject a little bit on the cartilages to kind of lift the tip up. But so the nose tip itself has two blood supplies. One that comes in off of the facial artery and it comes over here, right, over the nostril area. That's called, you have the facial artery coming up, lateral nasal artery. Then what happens is you have the facial artery that splits off into the inferior labial and superior labial artery that supply the lip that you can see there. And then you see those really tiny branches that are coming off of the superior labial artery, and they're going up right here, okay? Those are called the columellar branches. So what happens is I would say 95 to 98% of rhinoplasty surgeons in the country do an open rhinoplasty, which is different from what I do, where they make a cut here. And then they open up the tissue like they're working under the car hood, right? And then they sew it back. But every time you make a cut here, you're actually cutting those columellar branches. And that is 1/2 of the blood supply to the tip.
Wow.
So what happens is now if you see there's an incision here and this is cut, the blood supply to the tip is only relying on this lateral nasal artery. So if somehow you get an occlusion or compress that artery there, the tip dies in necrosis.
So what I want to just point out for those of you who don't know the big word that Dr. Bloom just used, an occlusion is when some of our filler ends up in a blood vessel. We would call that an emergency situation. The good news is a good injector will have Hylenex or dissolving agent on hand. And the second that they start seeing a loss of blood supply to the skin tissue, they can dissolve that filler, reverse the effects, and we can go on with our business. A bad injector might not notice what's going on, so we always tell you to ask what's going on for you. So I just wanted to clarify for those who don't know what the word occlusion means.
It's important to know, though, in this area, that an occlusion or a blockage of the blood vessel can happen in 2 ways. You can actually put the filler in the blood vessel, which is what you were saying, or you can compress it significantly because the skin and the soft tissue is really, really adherent there, right? It's like stuck down. So if you compress it, that's another way to like actually get the blood supply to die there.
Yeah, and it's also, as we talked about earlier, we can move up to the dorsal nasal artery up on top in this picture here. Bridge work is super exciting and important too, but you have to be careful with your injector. If they place pressure on a vessel and or occlude a vessel, you could lead to blindness. Am I right?
Totally. You can see those vessels there that are running from, as you said, like the dorsal nasal artery coming in, and that connects with a whole nother blood vessel system that goes to the eye, and that's like the sentinel retinal artery that actually give you vision. So there has been reports of blindness in this area. Also, I mean, most of the reports of blindness, interestingly, are coming out of Asia and like Korea, because when you look at all of their injections, most of the patients there are getting central facial injections. So you know, the pot is a lot bigger. So basically the risks and complications are a lot higher. So they're getting liquid nose jobs. They're getting brow and forehead injections a lot more. Because that's where a lot of
I don't know if you know this, Michelle won't do brow injections with anything but Botox because it's so dangerous. It's just not something we recommend. A lot of people have these deep glabellar lines and they're like, I'm tired of Botox wearing off. Put filler in it. Put filler in it. There are these major blood vessels up here that you mentioned them earlier that run through the eyes, and we're not going to take that chance. Your vision is not worth your vanity, if you ask me.
Totally agree. I mean, that you can see that one blood vessel running like right up here. The reason you get that line is not just the muscle contracting, but that is right where that vessel lives, right at the brow head. And if you go deep and you can knock off that artery, I can show you pictures. I've seen people with like black spots on their forehead where people have knocked off that artery and gotten necrosis.
Yep.
Yeah.
So I just had someone come through that hurt my heart a little bit, so we're going to talk about it real quick. She said that a liquid nose job is a waste of money. Why have to get it done when you can get it done permanently? My rebuttal is some people can't afford the downtime or the cost, right? So I know the average cost for a liquid nose job is $600 to $700. The perk is no downtime, and the con is it doesn't last forever, right?
So yeah, so there's a couple things that a liquid or a filler or non-surgical rhinoplasty can do. As you're showing right here, this is from you guys, that like you can camouflage a bump nicely. And I will say, using the right filler, you can get a nice year or sometimes even more result. And I usually tell patients 9 to 15 months for a non-surgical rhinoplasty or a liquid rhinoplasty. It can be more, it can be less, depending, but you don't have a lot of muscles that are working in this area, so it can last. But what a liquid rhinoplasty can't do is reduce the size of the nose,
Nope,
right?
not at
It
all.
can camouflage the bump, which, you know, she clearly looks, in my opinion, better. And so, yeah, people don't have the surgical downtime. The cost of a, you know, a surgical rhinoplasty is significantly higher than that. And, you know, it's also a way to like kind of try out things. It's like, oh, how is my profile going to look as
Right.
it's improved? Yeah, you can try it out.
You can wait out liquid rhinoplasty, but you cannot erase a surgical rhinoplasty. Once you shave that bone down, then you got to go back to adding bone, and that's just a lot. So we always recommend, if you're going to go for the rhinoplasty, maybe try it out with the liquid rhinoplasty first. Just to go backwards a little bit as well, another reason that you would be better suited to put filler in a nose that you've already operated on, you know what you did on the under the cover. You know what you did under the hood. Whereas if your patient came to me, I have no idea without a vein finder, which even isn't that reliable, where those arteries ended up post surgery.
Right. I mean, it's, you know, it's rare that I'll put filler in the nose after a rhinoplasty, but sometimes, you know, patients want it. Yeah, exactly.
Yeah, absolutely. Okay, so we have questions that came through. Let's go through some. Some of these are nose related and some of them aren't. So if you don't know the answer, there's no pain in saying, let's look it up later. My favorite response is, I'm going to have to Google that, because then I think it tells people that we're not lying. Because wouldn't it suck if you went to the doctor and they were like, I don't know, I guess that this is the answer. It's not. Okay, so let's go through it. Question. What is, explain the process of periorbital rejuvenation?
So periorbital rejuvenation is basically either a surgical or non-surgical approach to improving, rejuvenating the eye or periorbital area. It can start with something like brows, either surgical brow lifting or a Botox or a chemical non-surgical brow lift to raise up the brows. It can be as easy as some filler to camouflage the tear troughs or the infraorbital hollow area. It can be a surgical procedure to remove skin and, you know, tighten the skin or muscle, or even it could be a laser or energy-based device to kind of improve the skin and tighten that area as well. So there's like a bunch of different...
That's a loaded question, right?
Yeah, it's a bunch of different options
for it. So do you ever at any point shave down, remove, or add bone to the ocular area, or you always focus on fatty tissue or skin in that area?
So that's a good question. And then there was one question that I saw kind of run through the comments that I want to address. But when we're talking about the periorbital area, even if there would not be an instance where I would actually augment bone. However, they used to do these things like tear trough implants, like silicone implants there on the bone. I mean, they're kind of fallen out of favor at this point just because the stuff that we have, whether it be filler or fat, is so effective. So when I want to augment and I'm in the operating room and I want to augment the tissues of the anterior midface or the periorbital area, what I use is fat, right? It's readily available. It lasts a long time. The best studies out there show when it's processed appropriately, you'll get a good the best studies show 5-year uptake with the filler, with fat. And that's based on, Canfield studies, out to 5 years. So I love doing fat in this area. I think it really improves the periorbital area and gives you some volume. But I readily do filler in my office.
When you say processed fat, so you take the fat, we're going to say I have a love handle. Where's the easiest place to take the fat from?
So I usually either use the abdomen or I'll use the inner thighs because they're readily accessible when the patient's laying there. And then you process it. Either you take out all the oils and the broken fat cells. I use a product called Pure Graft, which is it looks like an IV bag, and it's a series of filters that you press the fat through. And what happens is it gives you this pure, consistent fat, and it's like a couple $100. I pay for it because I've been very happy with it, and it gives me. And some people centrifuge the fat. They do a number of different things.
Okay, so you said you saw a question come through. You wanted to tackle
Yeah,
it. Do you know what it was?
there was one question from Faraz. He's a dermatologist in London, actually. He was a fellow of mine a couple years ago, and he is a fan. If anyone's in London, go see this guy. He's on Harley Street, which is like the cosmetic street in London. But he was talking about, is it more difficult or more dangerous to elevate the tip with injection rhinoplasty? And the answer is yes. It's more important that you know the anatomy there. When you're talking about the tip, and I have this like big nose here, but the tip cartilages are here and here, and they are densely adherent to the skin. So in order to raise the tip up, you actually have to put filler right down onto the cartilage. So that's the best way to raise the tip. But it does take a little bit of, it takes a little bit of experience knowing what it feels like to inject on the cartilage. When I numb up a nose in the operating room, I know that feeling when I'm there. So when I put a needle in it with filler, I know what that feels like. But truly, to put it right here on the tip, you don't want to inject in the midline on the tip, but laterally on top of these lower lateral cartilages. That will give you that tip elevation.
Wow. So now, if somebody wanted to learn this, is this a technique that you teach, or do you send them places to learn it, or is it like practice by trial?
We teach it in our office.
Right,
and certainly, I have a nurse injector there, and my fellows and the residents. That's what we teach. Yeah.
That's wonderful. All right, I'm going to find another question for us because we've got quite a few. Again, if it's something you're not super familiar with, feel free to say pass. Let's do you know what 360 liposuction is?
360 liposuction. Now, I do neck and face liposuction, but I have a bunch of friends that I send these kind of cases to. 360 liposuction is just like full body, literally all the way around liposuction, abdomen, love handles.
Oh, it's not a brand. So this is not a brand. This is like a tummy tuck minus the tuck with lipo, like all the way
exactly.
around.
That's just like full body everywhere liposuction.
That's crazy. Okay, next.
Melinda's right that I'm a face surgeon. True. You're
this is a loaded question, Dr. Bloom. Are you ready? Surgical facelift versus liquid facelift. I just saw. I wish I would have grabbed it. You just posted. I'll pull it up real quick. A facelift Friday the other day. So let me pull that up while we chat. So a liquid face. I'll go first. A liquid facelift. Cost-wise, I always quote people between $4,000 and $5,000. It's not cheap, and it lasts about 2 to 3 years. We're going to use 4 to 6 syringes to give you lift in the cheeks, in the jaw, and in the nasolabial folds. We're going to pull it all back, but we're not actually pulling back. We're actually inflating these areas with filler, or filling these areas, which erases these lines and tightens up the jawbone. So that's how the liquid facelift works. It's all about volumizing the face. And now you handle the surgical facelift. What do you do?
Yeah, I mean, I don't really do liquid facelifts in my office. So, because
that's why I handle the liquid. You handle the surgical.
Right. So a facelift, in my opinion, is you have to release and resuspend the tissues, the soft tissues and the muscle, right? So it's more important to really actually free up the attachments, the dense attachments in the cheek, along here, the jaw, the mandibulocutaneous ligament, and in the neck, in order to get the face to move. So what happens is most faces have adequate volume. And when I'm addressing them surgically, the volume is just displaced. So I do a deep plane facelift. I'm doing an extensive release all in the mid face, in the neck, and in the jowl. And so it's, it's more like a repositioning of tissue rather than, rather than just putting some volume. This is a patient who is just shortly after her facelift, a couple weeks out, but improved neck, jowls, mid-face. I did her eyelids too.
So how long would this surgery take you?
This one is about 4.5 hours.
Okay.
Because I'm doing the whole thing. You know,
Right.
I throw every stitch of the case. I have a fellow there. I'm the director, one of the co-directors of the Facial Plastic Surgery Fellowship Program at Penn. So I do have a fellow there that is working with me and basically assisting, but I'm throwing every stitch of this surgery. So
Can
it takes a while.
can I ask you, I guess this is a personal question. Do surgeons get bathroom breaks? Or do you have to like start, hold it, not till we're done?
Yeah, that's it. I mean, there's no bathroom
Wow.
break, certainly. And
Wow.
so, you know, it's interesting. You know, my wife, who's a lawyer, she asked me like what it's like to do surgery. And the best kind of explanation I have for it is like, if you're, imagine taking a test for 4 hours or 6 hours. Like, when's the last time you've taken like a super long test, like the SAT, or I mean, I took the MCAT, right?
Yeah.
Where you're just totally focused for that 4 to 6 hours, whatever it is. And like, you're not getting up for breaks. It's just like the adrenaline takes over, and it's just concentration. And like, I don't even like
Hunger.
the bathroom
That,
is in,
that
I'm
makes
not even
sense.
thinking about that. I mean, it's
Yeah,
just,
that's
it is
crazy.
focus.
Do you do boobs at all?
I don't. I just
Okay.
do facial plastics, but
Got it.
I have a number of friends and colleagues who I refer to in my area.
So someone had asked if there are any breast implants that don't need to be replaced. We'll save that question for another day. Stretch marks, we're going to save that question for another day. Going to find some face questions. This question is more of a me thing. Is there an option for a facelift other than, is there an option other than a facelift for sagging skin? We do something in our office called microneedling with RF. So
You
radio
guys have
frequency therapy.
Profound, right?
Yeah, we have the Profound RF. It's about 40 to 60% of a surgical facelift, and it lasts about 3 to 5 years. On average for you, what does a facelift last? How long are people tight?
You know, I quote my patients that a surgical facelift will be anywhere for a 7 to 10 year improvement.
Wow.
Now, that being said, you know, it's like aging is like one of those moving walkways at the airport, right? You can get on it and I can like help set you back, right? But tomorrow, you're going to be more aged than you are today. But I will tell patients, you'll always look better than if you didn't have it, right?
And it's always good to be supplemented with fillers and Botox as well. We refer a lot of people to you for a facelift, but I let them know, hey, yo, you're still going to come back to me for Botox or filler because you're going to have to help.
Yeah, I mean, it's maintenance. You can't get a surgery and expect that it's going to, you know, be there for, you know, the results are going to be there for the lifetime of surgery. It's just
No.
like if you buy a car, there's maintenance. You gotta like, there's upkeep,
Yeah.
right? But the main structure, the jawline, the jowls, the midface, that's always going to be there.
So autoplasty, I've never heard of ear surgery. Is something you do or something you refer out? How's that work?
No, I do otoplasty all the time, which is like ear pinning, basically. There's two main reasons why people do otoplasty. So one is, so there's two important structures in the ear. See how on my ear here, there's like a little Y there, right? So that's called the anti-helical fold. And so some people, and I have a little bit of that, some people don't have that developed fold where the ear is kind of pushed back. So we actually use sutures to bend the cartilage and recreate that anti-helical fold. That'll make the ear, the helix part, sit back. The other issue is my finger is in the bowl part of my ear. See how some people have that issue where the ear is now pushed forward. And sometimes what we do is we set the bowl part of the ear back to bring the ear closer to the head. So you can have an issue with both where you're doing this and bringing it closer to the face so that the ear doesn't stick out as much.
So this sounds like a pretty quick surgery. Is it faster than a facelift or like still?
Oh yeah, it takes I would say about an hour aside.
That's not bad. I saw a facelift question come up that I'm curious about. Are subsequent facelifts more difficult for you, and are they more dangerous for the patient?
Good question. Hi, Julie. How are you? So what I would say that if I go back into, I've been doing this for just about 9.5 years now. So I haven't gone back into one of my faces like very frequently, because, you know, this is like maybe 7 years later, 5 years later, when they just want a little tuck up. And I know what I've done, right? I know the planes that I'm in. It does kind of help a little bit to get like the prior op note from the surgeon, so I know what kind of approach they're doing. But I do a deep plane facelift, and you'd be surprised. Most of the cases that I do revisions on, either in the neck or, you know, in the face, I'm going through the tissue is basically untouched. Revision facelifts are either very easy or very hard.
There's no middle ground.
There is no middle ground. And the reason is because it's like there's a plane of usually scar tissue, and sometimes if they're in the right plane, that tissue opens up really easily. The scar tissue actually is easy to dissect. Or it's a bear. You know, and it's really stuck down.
Do you know before you get into surgery, or it's like once you make that first incision is when you know?
You can actually feel a little bit of the tissue to get a sense, and you can look at the skin to see how it is. But what I'm doing is I'm releasing the deeper tissues. So most of it is you know, virgin tissue there that they haven't operated on. But I will tell you, you know, all bets are off. It is a little bit more dangerous. The nerves aren't necessarily in the same place. We're talking about the facial nerve here. This is the nerve that moves the face, lets you close the eye, helps you smile, you know, all these things. So occasionally when I know it's like a good surgeon who's done the surgery and I know their approach, I might not be in the same place. I might do something a little bit, you know, more conservative to protect myself and the patient.
So I saw a question come through. Cannulas in liquid nose jobs. So my office is trained in it. They've done it once or twice. They prefer not to. For us, they prefer the straight needle. A short needle gives them much more control where we're going to be in the right spot. But it also looks a lot scarier using a cannula in the nose. We use our BD needles actually for a lot of liquid nose jobs. Do you use cannulas in your office or not a fan?
I love cannulas. I use cannulas almost everywhere I inject is a combination of needle and cannula. So if I'm injecting the cheek, I'm needle on the bone, cannula over top of it, right? Lips, I'm using a cannula to give volume and a needle just to give a little bit of definition. Except the nose. I do exactly what you guys do. I use a small, like a backfilled 31 gauge BD syringe to, you know, put it on the bone there, and helps me kind of control small little aliquots. So I am not using a cannula on the nose, but there's not saying you can't. Actually, Steve Diane, who's a great speaker, he's a great injector, he's in the Chicago area, he uses a 22 gauge cannula in the nose. And he puts it like here or here to like augment the bridge. And, you know, his feeling is it's safe. And he's had great results. I don't do that.
I just got a question. Yes, Jay, my two girls, I will be taking this video, saving it, putting it in a better file format, giving it to Dr. Bloom to post if he wants it, and of course giving it to Meesha girls as well. I just found this question from Gabby DiMartino's biggest fan. How long does it take your nose to heal after surgery?
You know, I take a, you know, I will tell patients usually, I tell them to take about 7 to 10 days off work. Certainly because I'm doing an endonasal approach for a primary rhinoplasty, most patients are back to like work by 2 weeks. And it's usually, and I do a lot of out of town patients too. I have patients that fly in for surgery. I mean, this is good for me this time because I continue to do these virtual consults, and I always see a patient in my office prior to doing surgery on them, whether it's the day before or, you know, weeks or months before. But I just did a consult from a girl from Jupiter, Florida, and she booked her surgery. She's coming in the summer to have her nose job, hopefully.
So you're taking this social distancing very seriously. You're not letting people come to you from Florida right now. You're like, hey, stay in Florida. I'm staying up here in Philadelphia.
Yeah, no, I mean, 3 weeks ago, I did a surgery from a patient from Iowa and a patient from San Francisco. And so the downtimes of like what I usually tell them is the splint comes off at somewhere between 4 to 8 days, usually 6 days, because I operate, like, for example, on Wednesdays and Fridays. I would see a patient back on Tuesday, like 6 days, Tuesday or Thursday, to
Right.
take their splint off, and they're totally able to fly back home or, do most things at that point.
So you see the
But
secondary question, the working out, does that include working out, or how long are they no working out for?
so no working out, I usually say, so basically no blowing their nose, no strenuous activity or cardio for 2 weeks, heavy lifting 3 weeks, contact sports, because it takes, the bones to heal. Look, I do a lot of like local high school and college level, athletes, basketball players who've broken their nose, that kind of thing, male and female. And I don't let them go back to that, where if they get bumped in the nose, the bones can shift for 6 weeks.
That scares me.
Right. So there's a person that I work with that makes those like face masks. Like, remember Joel Embiid had that face mask? Yeah. So you can wear those, and it's really to protect the bones from shifting after surgery.
Okay, so I have this question. Where did I get this shirt from? We actually made these. They say
I
Meesha
like
on the
them.
bottom. So we made those. You can't buy those anywhere. Let's see what else I got going on here for you. Oh, this is a fun one. This is a little more personal. What surgery is your favorite to do? Is it noses? Is it something else?
Yeah, I would say my favorite surgery, and kind of what I'm known for, is I like aging face surgery, but I love rhinoplasty a lot. Primary noses, first time rhinoplasties are like my favorite. I do the most of them. I usually, when it's a busy time, somewhere between 4 to 6 a week.
And if you've had, sorry, another question about rhinoplasty. I've had one before. I'm not happy with the shape. Can I get another? Is that dependent on the person? Is it a yes for everyone? Is it a no for everyone?
Yeah, I mean, it's important that you actually seek out a surgeon who does who does revision rhinoplasty, who's familiar with it, and to get it's impossible to give you an answer. I mean, I do probably about a quarter of my surgeries, nose surgeries, are revision surgery. So it's important to get an actual consult. I have to get in there, look, my best friend, the best way I can put it is, my best friend is a orthopedic surgeon. And he asked me, he's like, what's the hardest surgery you do? And I said, hands down, revision rhinoplasty. He's like, that doesn't seem like really difficult. I don't understand. And I said, if someone comes to you, and he does a lot of sports orthopedics, I said, if they have like a blown out ACL or maybe two on the same side, whatever it is, I said, the patient comes to you with a CT scan, an MRI, and an X-ray, and you probably don't even have to see the patient. What lies beneath from looking at all that imaging. But for me, I have to use what I learned in my residency, what I learned in my fellowship, and also like now my experience in doing this, in actually seeing where the cartilages are, what's the orientation, what was done. And sometimes I can have a great example that, like, so that case with the rib, I was prepared to need rib cartilage for that. But when I got in there, it was totally unlike what I was expecting.
Because you couldn't see inside.
And sometimes, because all of the cartilages were gone. All of the intrinsic cartilages to the tip were missing. And so that's because they had been resected or worked on, and like, or, whatever it was, I had a plan, and then
all gone.
It's all out the window, and then you're coming out with new plans. And I was lucky that, my fellow was there too, giving me some of just, his advice, in like, how about we look at this? Yeah, it's great when you have a team that can think about things, and, he's like, well, how about you try this? What do you think this will look like? And, to do a couple things before, just some other input is great as well.
So we have one last nose question before we jump onto our last topic, but I got a rhinoplasty last July. My tip still feels hard to the touch. Besides massaging, is there something else that this person could do?
Yeah, so it's not unlikely that, sometimes if the tip is hard, that's probably a good thing, in terms of it's probably well supported from the cartilage. Sometimes we'll use injections like steroids and or a injection called 5-FU, fluorouracil, to actually break down scar tissue. So if it's hard, it could be scar or it could be cartilage that's supporting things. It's important to talk to your surgeon and actually ask, because sometimes I will inject a little steroid or fluorouracil to kind of break down some of that scar tissue and soften things up.
So we have another question here. So many people trying to get into this field right now. What advice do you have? I'll go first for this one. If you're looking for injectables, what I recommend for sure is you have to be a nurse first, minimum, especially in the state of Pennsylvania. And then I also want to remind you guys that where you get your training really matters. So Michelle, our head injector, our lead injector, whatever you want to call her, is a national trainer for Allergan, Galderma, the Injectability Institute, Geneva. You can always book a class with her. That's how we recommend for injectables. And then you really want to find family to practice on, but not outside of the office. Make sure you bring them into a well-known office. How about for you? If somebody wants to get into plastics, what do you recommend them to do?
In plastic surgery?
Yeah.
Oh, so plastic surgery is a long road. So I did facial plastics. So I did my residency in head and neck surgery at Penn. And then I did an additional fellowship in facial plastics at NYU in New York City. So there are a bunch of different ways to do it. If people are interested in cosmetic or aesthetic surgery, there are, through the American Society of Aesthetic Plastic Surgery, there are aesthetic plastic surgery fellowships. There are facial plastic surgery fellowships that only we can't. So I'm one of the directors of the Penn Facial Plastics Fellowship. And actually this afternoon, I have like a Zoom, or it's either a FaceTime or a Zoom interview with an applicant. And we got, I think this year, we had about 50 applicants for one spot. And that's for 2 years from now, because we have our fellow picked out already for next year. And
that's crazy. So it's a long road. I found two other questions I love. One, and this is going to be, I think, very personal based on the person. What age do you recommend getting a facelift? Is there too young, too old?
Yeah, I mean, we're seeing facelifts actually, interestingly, a little bit younger. Now, I would say in my practice, and this is just for me, that patients who I call my tweeners, and I've kind of like coined this term tweener, and for me, a tweener is a patient who's like, for example, mid to late 40s, early to mid 50s. There are things that we can do non-surgically. You would do like profound RF microneedling on those patients. I do a lot of ThermiTite, which is that percutaneous RF to help the jowls and the neck. And for me, that group, the early, mid 40s to early 50s is excellent for that kind of therapy. Because in my office, all comers, my average age for a facelift is usually around 60. So that is, kind of the mid to late 50s, early to mid 60s. Those are the majority, probably 85% of my facelift patients. And when I'm talking facelift, I'm talking really jowls, jawline, neck. But like recently I did a patient in her early 40s, like 43. The reason was she had had a massive amount of weight loss. She had undergone, and she had just a lot of extra skin. So she was in her early, in her early 40s, but she had a great result from her face surgery.
Yeah, we see that a lot. People who lose a lot of weight. I see it in two cases. I see a lot of people come to me earlier than usual, extreme weight loss, extreme grief, and then also HIV patients who might have progressed a little further, have atrophy of the skin tissue. They want to give that themselves a little bit of a lift.
Exactly.
The last question we're going to take before I ask you my last question is, do you recommend people visit multiple surgeons to get multiple consults, visit the same surgeon for multiple consults, or is it like, I read great reviews, had one consult, surgery next week? What's the process you recommend?
You know, I'm like, please go see a few people, because I like a patient that comes in and is a little bit more educated. But you need to have a connection with your surgeon. You need to understand, and they have to understand your goals and basically objectives for the surgery and expectations. And I need to make sure that their expectations and goals line up with what I'm thinking as well. The one other thing that I will tell you, that, when I ask a lot of my patients, can I, post your pictures or can I use your pictures? I'll ask them a lot, can I show people the entire,
Process.
the whole process? Because just by looking on my website, or, my website isn't great, but like Instagram, or coming in and seeing somebody's before and after, for me, that's like reading the front cover of a book and reading the last page. Do you have any idea what the story is?
Yeah.
No,
It's a really good analogy right there.
Right. So like, patients want to know, what am I going to look like one day after? What am I going to look like a week or two after? So that they can plan their downtime. They can say, okay, this is normal. This is kind of along the same lines as what he showed me. And like, some of the pictures have some bruising in it and some swelling.
Some of them look scary.
This is what you're going to look like at 2 weeks. This is what you're going to look like at, a month. And then they're like, okay, I can deal with that. But, make sure you see the process. That's what I'll tell you.
Someone's question came up that is a lead on to this question. Have you ever said no? And that's part of the reason we asked you to get multiple consults, is I need to check your sanity. I mean,
totally.
You come into me with a nose that's a size XL and you want me to go to a size small, I will say no to you because you're going to be dissatisfied, right? So have you said no to patients?
I mean, almost as much as I say yes sometimes, like.
Same thing with, fillers. If I ask your budget and budget is $1,000, but you're expecting to look like you spent $3,000, I'm not treating you for $1,000 because you're going to be dissatisfied, and that looks bad on me. So I have to make sure you communicate during the consult process that your budget, your expectations, and the amount of downtime you can afford works.
Yeah, especially when it comes to noses, I think it's very interesting. People have these, like, there's like these face tuning apps and stuff, and I actually just published some interesting an interesting study that we talked about.
He's a published author, ladies and gentlemen. I see.
No. What we wanted to get a sense of was, are people using these, and how it's actually influencing people's decisions towards facial plastic surgery. And, people will bring in a picture of their favorite celebrity and like, or face tune, or, do something to their face, and they're like, this is what I want. And
you can't have it.
Well, they don't realize that, like, I'm like, this is what's doing your surgery. This is not a computer program that I can just like type in this nose on this person and just pop it on there. There's human error. This is me doing your surgery with my own two hands. So I'm like, and people will also bring in imaging, for example, from a different surgeon. And they're like, I want this. And that's why I don't give out my imaging until somebody books surgery with me, because that's part of my intellectual property. That's like, I don't even want to see what that person says they can do. I'm going to show you what I think I can do for you, because then our goals are aligned. If you don't like what I'm putting out there as to what I can do, you don't want to come to me, because
it's true.
We're not on the same page.
Well, so speaking of, we're going to segue into our last topic, which is the future of, what's going on in the world. But I actually just had someone 3 days ago send me a picture of a filtered photo in which her eyes were a different color. And she asked, can you use Botox to do this? I said, yes,
God.
Let me take you from brown eyes to blue eyes with Botox. What? So really, I mean, to everyone watching right now and whoever watches this live stream later, let's really focus on A, realistic expectations, and B, remember that Facetune isn't reality. I always tell people to think filler, not filter, because filler is you just enhanced. Filters is a whole new you. And that's not what we're trying to accomplish here, right? Okay, so Dr. Bloom, last question. We're going to say goodbye to everyone because it's been an hour already. Can you imagine? What have we been doing with our day?
It feels like it just flew by, Chris.
I know, right? So you focus on noses, but you're publishing an article about filters right now. What have you seen the trend becoming, and where do you think it's going? So what's going to be popular? What is popular now that wasn't last year? What do you see coming down the pipeline?
Well, in terms of like injectables and things, I think this is going to be, well, it was going to be an awesome year for new innovations and new things.
Yeah.
Certainly we have new products coming out. So product from Galderma, Wrestle Kiss is coming out probably it was set for May.
Fall. Yeah.
I mean, but that's really exciting new lip filler. In the neuromodulator world, Revance has a long-lasting neuromodulator that right now the FDA has set it's called the PDUFA date, where the FDA approves it for
what?
Yeah, the PDUFA date.
It's a real word?
It is. It's an acronym. I don't know what it stands for.
I get that question a lot though, is why can't my Botox last 6 months? And I keep baiting people. Hey guys, like they're working on it. As soon as it's available, we'll give it to you. We're not holding it in the back for us.
Yeah, but that's set for November 25th right now. So hopefully around Thanksgiving time. They've also acquired the Teosil line of injectable fillers, which are very popular in Europe and throughout Canada, throughout the world, which should be interesting. And then in an area that I don't treat much, but I think it's kind of really interesting, is a company in our backyards, which is kind of cool. Endo Pharmaceuticals, which is based in Malvern, PA, is coming out with an injectable to treat cellulite. And that should also be in the fall, which will be really cool. And you'll be able to inject it into the buttocks area, and actually it will kind of cut the dimpling in that causes cellulite. So
we just saw it in action. Have you seen it yet?
I have been involved in a number of different things with the company.
I know, you and I are walking on eggshells, like, what are we allowed to say?
Exactly.
Yeah, you're totally right.
I need to be careful about that, but it is, it's publicly publicly known knowledge that is coming probably in the fall time.
So hopefully we can kick Corona's butt. So you all need to stay. So on a closing note, Dr. Bloom, you all need to stay home so that our people who are making 6-month neurotoxins, cellulite erasing injectables, lip fillers that are brand new can do their job. And to do that, they need to be able to go to work and not be sick. So I'm glad you're taking your precautions. Is there anything final you want to say to the world of Instagram / when this video lives on forever?
Well, first of all, I love you guys there at Meesha, and thanks for having me on here. Certainly, we are really, during this, it's a difficult time for an aesthetic business. Certainly, you guys are all aesthetic and me too. And I just want everyone to. And I just want everyone to know that, like, we're going to take every precautions to take care of our patient safety, our staff safety before we're doing anything. And no matter when anyone says that you can open back up, it's really important to consider, my patients, my staff are like family, and my own family, the safety, and protecting them is literally number 1, 2, and 3.
Have you had anyone offer you an exuberant amount of money to do their injectables at their home yet? Because I have, and it's weird.
Yeah, I've had people like reaching out, can you come? And it's just, what, it's not worth it.
So just so you all know, we're not doing that. Neither Dr. Bloom's office nor Meesha will come to your house to do your Botox.
Yeah, no, definitely not.
It has been a fun hour. I'm back tomorrow with Michelle. We're going to chat about at-home skincare. You guys, we're giving away $1,000 worth of Meesha money right now on our Instagram and Facebook. Go visit that. Dr. Bloom, thank you for taking the time to chat with me today. You stay safe and sane. And let's do this again in a couple months, but from our offices. And
I love that.
We can most definitely hang out and have another event sometime.
Cool.
Bye,
Stay safe, guys. Much love.